Okay, I guess we can get started, and then anyone else that would like to join us will come on in later. My name is Morgan Fredericks, and I am the admissions officer for our spatial analysis for public health programs. So again, welcome to the panel today. I will do our program directors and give them an opportunity to introduce themselves before we get started.
Thank you, Morgan. My name is Frank Curriero. I'm a professor in the Department of Epidemiology at the Johns Hopkins Bloomberg School of Public Health. My degree is in statistics. I sit in the Epi department. It provides a unique setting to kind of get closer to the data and closer to the people that are on the front lines of collecting the data and analyzing the data, and so forth. I focus in an area of what's called spatial analysis. I think that's probably clear. I lean more on the spatial statistics side of things. And my colleague and I, Tim Shields, we both co-direct this program in spatial analysis. We developed this probably about 7, 8 years ago, maybe, Tim, something like that. It was one of the first,
2016 was the first, yeah.
yeah, one of the first online programs that the school had, and they chose spatial analysis to be the first one, and because there's a huge need of it out there, and so forth. So that's who I am. I will transfer it over to Tim now to introduce himself.
Hi, everybody. I am Tim Shields. I am also in the epidemiology department. I am a geographer by training, and I focus more on the GIS applications end of the spatial analysis. Both Frank and I are part of the spatial, the Center for Spatial, Frank, Spatial Science for Public Health Center. Yeah, trip all over those S's. But so it's a pleasure to be here today to talk about our program. We have with us one of our alums, Marty Ross. Uh, I'll say he is fresh back from chasing the eclipse down at Mazatlan. So glad he could make it for the talk today. I'll just say a brief intro. He started in the fall of 2021, I believe, graduated in the spring of 2023 with his MAS in spatial analysis. I remember your integrative activity, which is basically his capstone at the end, was about wildfire smoke in the state of Washington. And I wrote this down, he's currently working at the Washington State Healthcare Authority as a policy analyst, and he's collaborating with the Institute for Health Metrics and Evaluation at UW, or University of Washington. So I think next maybe we'll have you, Marty. Maybe you can give yourself a proper introduction, and then we'll start the program after that.
That sounds good. Yeah, so as Tim said, recent grad, actually went to Baltimore to walk with a number of folks from our cohort. We were very close and had a lot of good times together, doing homework assignments and whatnot. So yeah, and I've been working for the last 6 months for the state of Washington, the Healthcare Authority, as Tim mentioned. Yeah, working with the IHME at UW, and they're doing some evaluation of healthcare costs in the state of Washington, breaking things down by county, and trying to see if we can get more granular than that. And yeah, the geospatial techniques come in real handy. So yeah, thanks a lot for inviting me.
Thanks, Marty, and everybody for the introductions. So the way we thought it'd be best to kind of run the show here today is, I'll start asking Marty a few questions, but these are more conversation starters. So Marty's an alumni, and we want you to hear things in his perspective about the program. So Marty, I'll ask you a few questions, and again, these are just conversation starters. Feel free to branch off in any direction you think would be helpful for a prospective student. And obviously this is going to be recorded, so it's going to be sharing with other prospective students. So I think we'll do that for a little bit first, and then we'll pause and we can open it up to the attendees, get specific questions from the attendees, and then after that, Marty will follow back up with you for some more questions and conversation starters, and in the program like that. So let me first ask you, Marty. So I assume you didn't come right from undergraduate to our program, right? So why at that point in your career, whatever point you were at, why did you consider grad school at that point in your career?
Well, so I definitely came to this program in a very strange path. So I've been working in biotechnology actually for about 20 years. And I'd been doing research, inventing different things, doing different types of analysis for brand new tools in that space, looking at cancer biology. And the company that I was working for, they actually were becoming a spatial biology company where they were actually looking at individual RNA transcripts in cells. So the output is basically like a map. You know, this RNA is here, this protein is here. And I was actually kind of looking around, you know, how could I understand better algorithms for spatial analysis? And so actually this program kind of found me. I was really interested when I saw an ad for it, and it seemed like this could be something interesting. I'd always meant to get a graduate degree, but never quite found the time. And I think the timing was right with the pandemic happening, where all of a sudden I didn't have a commute anymore to my job. So
None of us did.
um, yeah. So all of a sudden I had time. And so, yeah, grad school seemed like a really good opportunity to really further my career, actually. And yeah, kind of a funny thing happened along the way. I actually really started to fall in love with the kind of work in the public sector. And so that's kind of where I switched gears from moving from the private sector to the public sector. So yeah, I went from, it was very much life-changing, but yeah, for the better.
Yeah, so I remember now the story about how you came to spatial analysis, and that is kind of unique in the sense that, we're in a school of public health, so all our applications are, on the earth, the map of the earth, and looking at variations in health outcomes across communities and things like that. But everything we teach here can easily be applied. The earth doesn't have to be the backdrop for everything. It could be an organ, it could be a cell, and you're looking at locations of events or outcomes on that perspective. So yeah, very very interesting how you got into spatial. Um, what
And
attracted you to?
I'll
Yeah,
interject real fast, actually. It's kind of interesting. Working for the state, I actually am able to still do a bit of moonlighting. So I still do some work in spatial biology, and I'm looking to try to introduce a few approaches that I learned into that field as well. So
yeah.
yeah,
So
keep them
just
very
because you
busy.
brought that up, let me dive in and be a little bit more specific. So, prior to our getting to our program, were they using certain methods and techniques, and did you learn new ways to kind of help them with that? I mean, how was that interaction? Were they already using methods that we taught? Were they not using methods that we taught, different methods?
You know, it's interesting. It's still a very nascent field, and looking to find new approaches for how genes are interacting with one another. So, finding how much certain RNA transcripts are clustering in different groups of cells within organs, um, finding where things are outside the norm for in cancer, how the body is short circuiting. Yeah, these approaches, they're still kind of being introduced, and yeah, so I'm looking to do a little bit of that for a publication in the next few months.
Okay, great. Why Hopkins?
Why Hopkins?
You look at other programs.
It's a good school. People know it, especially when it comes to public health. It really is top notch. Um, and I don't know, maybe it was because I used to watch The Wire, but I always felt a kinship with Baltimore, even though I was born and raised in Seattle. So,
Okay.
um, yeah, it's yeah, definitely a top notch school that people recognize when they see it on your resume. Take it seriously.
So let me just take a minute here and speak to the whole group because Marty was talking about what draw him was spatial biology. That's not an area we necessarily focus on, although like I said, and like Marty exemplified, the methods translate from one field to the other. Um, we're in public health, and so Tim and I, we've been teaching this stuff on site to students for the past 20 plus years. And during that time, we've developed what we call the spatial science paradigm. Okay, and it's got three primary components to it. And these components guide how we teach, these components guide how we do research, and they guide how we mentor students. So the first component is spatial data. When I and Tim, he's just as old as I am, looks younger, but just as old as I am. Um, when
Feel
we
older, yeah.
started in this field, you know, getting spatial data was really hard to come by. I mean, I was delighted when somebody knocked on my door and said, "Hey, do you want to analyze this data? And by the way, I've got the lat long locations." And that person was Tim. That's how we kind of first met. And I never asked where the data came from. A couple generations later, now you guys, the availability and the accessibility to spatial data has just exploded over the last 10 plus years, and it's at everybody's fingertips now, whether it's on your phone, whether it's on your computer. I mean, you can get this data everywhere. So a big part of our program is that obtaining, collecting, and creating spatial data, and getting all that data. And then once you have that data, actually want to make a map. We're a spatial analysis, so we want to make a map. And there is this software out there called the GIS, Geographic Information System. That's a generic name. There are certain types of GIS software out there. We focus in Esri products. ESRI is the company. So this is ArcGIS, ArcPro, those kind of products. And so the GIS is your map maker, right? But it's a little bit more than just making pretty maps. It enables you to bring spatial data in from all different components and integrates it all together and kind of spatially link it together. Maps are, there was a New York Times article once called GIS, a layer cake of information, because that's basically what it is. You have these different layers and you can overlay them, all of them, a few of them, toggle on and off. And that's what GIS really helps you to do. That's one of the functions of GIS that is so tremendous and powerful of the software. So we spend a lot of time teaching that software. Okay. And but the map is great, and that's an end product of GIS, and it really makes you think, and probably one of the more recent and probably likely the one of more famous applications of maps and how maps can make you think is all the COVID maps that came out, and the Johns Hopkins COVID dashboard, which became so popular and well known, and it really makes people think, you know and that's one thing that I always talk about, that maps are such a great for. But it makes you think, and then how do you want to follow up on that thinking? So our last component, so we have spatial data, GIS. The last component in our program is spatial statistics. It takes the map as the input, and it provides you the tools and techniques to, what we say, go beyond the map and actually analyze the patterns in the map. And are these patterns consistent with our objectives or our hypotheses and stuff like that? So the spatial statistics is another key component to our paradigm, but it's also a key component to our program, because at least when we started this program, there weren't dedicated, I'd say, dedicated classes in spatial statistics. Spatial statistics shows up in a lecture or two in different geography classes, but our program has dedicated courses. We have two courses in spatial statistics, and they're taught by a statistician, being me. All right, so it gives you the perspective I think is needed, and not being taught by a geographer or someone else. So we have our GIS classes. Tim teaches the GIS classes. He's a geographer. I teach the spatial statistics classes. I'm a statistician by training. So that's sort of what encompasses our program as a whole. And I want to get off my soapbox now, Marty, and get back to you. So having heard that, can you provide maybe a few comments leading off of that?
Yeah, I'll say that it's kind of interesting. You mentioned that the outputs, we use Esri products, but something that really came in handy as I was moving through the last couple terms of the program, I really picked up doing mapping in R, actually. We had a number of assignments that kind of started us along that path. And I picked up a lot of skills in that regard. I've been using the R language for a while at work, actually. That's what my spatial biology company was specializing in, what the code base was built on. But mapping works really well with R. As long as you've got a shapefile, you can load it and you can overlay whatever information you want on it. And, you can produce images that you can drop into documents. I did my capstone, as you mentioned, in wildfires. And I actually had a Shiny app that I did where you could kind of move through the state of Washington, city by city, county by county, and look at how many smoke days there were over the last 10 years. So there's a lot that you can do, even outside of Esri products. And it's kind of been interesting being at the Healthcare Authority. I've been trying to build up a small group kind of in scattered places. People have worked with GIS products before and kind of developing tools, sharing tools. It's been pretty great. I've gotten a couple maps that I've produced and put into our government reports. But yeah, it's been a lot of fun because while I do work primarily with the IHME, that's the bulk of my job. Yeah, helping out with other outputs, other plots and graphs and maps is what else I do at the HCA. So yeah.
Great, great to hear. And so you reminded me that another distinguishing feature of our program is that we also teach in R. So we teach all the GIS and the mapping in Esri products, so Arc Pro, and Tim is an expert on that. We teach the spatial statistics in R. Now, there's a lot of software now available that does spatial statistical applications, and even in the Esri GIS products, there are functions to do different types of spatial statistical analysis. R, if people are not familiar with R, it's a very comprehensive spatial statistical programming language. So not just spatial, does everything else. And there's a lot of reasons why we use R in our spatial statistics courses. So you come out of this program knowing both the GIS products and also R, which is I think a tremendous benefit to the program. But you know what, we've been going on for about 15 or 20 minutes now. Maybe it's a good idea to open up to any specific questions we have from our attendees. We only have a few of them here, so please feel free to unmute yourself and ask us any questions that you have on your mind so far, based on what you've heard.
I can start. So I'm interested in public health is my background. I work for a health system, but in public policy. And I just recently came across this because I'm interested in getting my PhD. I do have a master's in public affairs, and so I don't have public health though degree. And my question is, could this help me with my PhD, one? And then also my focus of identifying like food deserts, maternal deserts, housing is huge right now, and health equity, and using these different tools. I definitely understand and know that data is very important when telling the story of health equity and helping to try to, I guess, negotiate and also help inform certain policies that we're trying to have different members be supportive of, along with the stories from the individuals. So how does that marry? If you could just talk a little bit more about that, and is there some focus on health equity too?
Yeah, so great questions. Go back to the beginning. A lot of PhD programs require students to have a master's degree coming in and a couple years experience. At least I know Hopkins Epi PhD program does. We've had students that have gone through this program and onto a PhD program. So it definitely could be the master's program that you want, or that could help you benefit for that. Um, you mentioned food deserts. So the Center for Livable Future here at Hopkins, I think, was one of the first centers that coined food deserts. And
I
Tim
think
can
it's
speak a little.
it's
Huh?
been
Say that?
I think it's been recoined. Food
Yeah,
security now, I think,
yeah,
or
yeah.
you know.
But we actually use some of their data in the GIS classes to reproduce food deserts in Baltimore. So in terms of the actual specific application, so you're interested in health equity. Um, Another distinguishing feature of our program is, so it has this, we call it integrative activity. Marty touched on his a little bit. It's the capstone of the course. You work on this, you started in year one, but you really finalize it in the last term of the program. And we allow students to bring in their own data and to work on their own data and build a project around their own data if they're lucky enough to get their own data and have their own project and set of objectives. So that's where a lot of students really get into their niche and focus on what they want to do. It's not a requirement to bring in your own data. Students that cannot, for whatever reasons, we have what we call a set of design projects that students can pick from to use for their capstone. One of them actually is a food desert application in Texas. And so usually you have about, Tim, it goes around like, it hovers around 50%, I think, students that bring in their own data and students that opt for one of our design projects. But in terms of, your specific interest, you said you had interest in health equity. It's part of it is on you thinking how you can apply these methods. We try to teach the methods. Yeah, we'll use case studies and so forth to help teach the methods, but a lot of it is transferable to other outcomes and other situations, or even other fields, like Marty jumped from spatial biology into public health. So it's all related and interconnected, but the integrative activity would be an ideal way for you to really bring in health equity data and focus on that.
I would just add, and from the GIS end, we do the GIS course first term of the first year, and it's set up with basically 4 case studies, and we give you data, we give you background, we give you instructions on doing the GIS functions to integrate this data and get it suitable to answer questions. But one of the case studies is the food desert in Baltimore. So while you'll learn to build your own food desert. But building a food desert is kind of the same thing as making an index. It's combining these different layers, different criteria, and then aggregate them together, and then you determine where's the area of the highest risk, for food desert or health inequity or whatever. So it's you can take all that approach and you can refocus it towards a different kind of question, and that's what we encourage students to do, like from day one. So while you're building a food desert, you can be applying this to some other question that you may have, and we kind of try to help you hone that question over the first year, and then in the second year, as you're building more spatial skills, we keep adding more to it. So now you're building your whole integrative activity throughout the whole second year. That's the goal of that.
I could also add, working at the Healthcare Authority, actually, there is an upcoming project that was funded by the legislature to look at maternal health deserts. They're still calling them deserts, I think, at this point. But yeah, I was actually going to be helping out based on my background that I learned at Hopkins. And at this point, it's a bit exploratory. It's really just trying to get down to a set of uh, uh, things that you can map, uh, different statistics that might be informative for outcomes. So yeah, looking first at exploratory analysis and then trying to develop some criteria to define what a desert might be for maternal health. So yeah, definitely a lot of good work being done in this space.
Other questions from our attendees? Thank you for that, Iris. It was great questions.
Hey everyone. So I just recently graduated actually in February with a major in geography and minor in global health. And I've done my pre-medical coursework, so I'm interested in medicine. I was just wondering to hear, I know this program is mostly built for working professionals, and that's sort of why it's done part-time. I was wondering if there are any students, or if any students have sort of pursued this program directly out of their undergraduate degree, or if you guys sort of recommend having some professional experience before delving into this program. And I just was super interested in it because I've done some spatial accessibility research in Vermont over the last year and have really loved it. And I've sort of reviewed the coursework as part of this master's program, and it really strongly aligns with my interests. So sort of just caught my attention, but I'd love to hear your thoughts.
Yeah, great question, Sam.
On that, yeah.
You're right that it is designed for the working professional, but that doesn't mean anybody straight out of undergraduate can join. And we've had people straight out of undergraduate in the past join. There is nothing. I mean, I say, it was designed for the working professional, but that's mostly because of the part-time and online. Other than that, there's no different that prohibits or benefits coming right out of school versus being in the workforce for a while.
Yeah, I'll say that my work working with the IHME actually out of University of Washington, they're certainly a mixture of people who are full-time, uh, spending full-time studying, but also people that mix work at IHME with the school work. So yeah, it's pretty nice and flexible that way.
Yeah, you'll fit right in.
And a follow-up to that question is, how really like part-time is it? Like, can you sort of give an estimation of the amount of hours that students spend on their work a week? Or I'm just trying to sort of gauge how much of a work week like being part of this program would take up.
Yeah, they usually say so. Hopkins, this question gets asked a lot, not just for part-time programs, but I think Hopkins usually gives an estimate of about 3 hours per each credit of class. So if you're taking a 4-credit class, think about 12 hours a week. But that comes from the administration. I want to hear from Marty because he actually took the classes, and I think you would probably believe his answer more so than me referring what the administration says they expect or would expect.
Yeah, I'll say that certainly there were some courses that maybe because I'd had some background in them, they weren't as challenging as other ones. I'm thinking about like epidemiology. It had 2 courses in that, and those were pretty comprehensive. A lot of reading. So all of it, of course, is offline. You can, except for meeting together as a class periodically. But yeah, I think that 3 hours as a mean makes a lot of sense per credit.
Okay.
And Sam, just everything we're talking about online or offline, even it's asynchronous. So in the GIS classes, you'll get basically 2 weeks worth of material, like on a Sunday night, and you have like 2 weeks to get the final assignment in. And so you can kind of schedule that work around your life. So some people do it like at night after their day job. Some people just do it on weekends. Other people do it during the day. So then that's the flexibility is to be able to do that.
Great, thank you.
And what's really also nice about the program is like Tim said, the asynchronous part of it, it really helps. It fits into your schedule rather than you fitting into our schedule. But we do have live talks like we're having now, 4 times each term. So every course has like 3 or 4 live talks. So we'll get on as a group with all your students in your cohort, have topics to discuss, Q&As and things of that nature. So there's that connection there. And there's also what's called, so Hopkins has what's called Course Plus, which is all where your material sits for each course. And I know every university has a different thing they call it. But our Course Plus has what's called the discussion forum. So you can post questions on there and you'll get responses either from Tim, myself, the TAs, and other students. So it's really a great way to kind of interact. I know students went off and made own Facebooks by themselves and they connect that way. And I'll ask Marty later on a little bit more about how he connects with students during the program and maybe even after the program. So it is more than it's there's a little bit more hands-on with from us, from our end, so you do get to see us, talk to us in a live setting, more so than just hearing the recordings and so forth.
Yeah, definitely. We different student groups, we meet for brief Teams chats and whatnot, chatting throughout, just texting back and forth. But yeah, also putting together meetings for whoever can show up. So yeah, certainly plenty of opportunity to connect with fellow students and work together on problems. Yeah, work your way through our code, all kinds of things.
And we encourage people working together like that, on problem sets and so forth. So there's nothing, there's nothing nefarious about doing that. We encourage that. So great question, Sam.
Yeah.
Do we have other questions from attendees? Okay, so Marty, I think Tim's going to follow up with some more questions/conversation starters for you. And don't mean to keep you on the hot seat, but I think you've been extremely helpful for the students.
I think it sounds better coming out of your mouth than ours in some circumstances. Marty, I want to see if you could speak about kind of things within the program, like the program design, or how the lectures are set up, or how the presentations are made, and then I guess we covered a little bit about interactions with faculty, but part of that was us speaking. But maybe you want to give your 2 cents on that. What's been for you?
Yeah, I thought that the whole course design, just over the 2-year path, I think it just made sense in terms of how individual courses were planned out. You start kind of simply getting up to speed on current applications, ArcGIS, before really starting to dig into some of the more public health focused coursework, which was brand new to me. So I learned a heck of a lot there and I really enjoyed it. And then moving on to some of the biostatistics, and then that as a jumping off point for spatial statistics. I thought that it really kind of ramps up in terms of complexity, but also, yeah, just kind of lets you follow a course that makes a lot of sense before completing the capstone or integrative activity at the end. So yeah, I thought that it was really well thought out. And it's interesting too, because you're actually part of a larger community in the School of Public Health, part of the OPAL programs, because some of the coursework is definitely your small cohort of 20 students or so. But then there are larger courses like biostatistics where multiple programs at Hopkins, they'll also be in the class. So you'll end up in courses, classes that have 100 people. And yeah, so you can draw on a lot of help from your fellow students for some of that coursework as well.
So Frank had mentioned Course Plus, and we're saying that's our platform for dishing out all the course materials. But part of this this is the discussion forum where we were mentioning to Sam that you could post a question any day, any time, day or night, and get some response pretty quick. But we try to like foster a coffee cafe community there where there's other places to post other interesting things you come across. I mean, it could be program specific. How do I figure out this GIS function that's giving me a headache? Or you could say, here's a cool article, here's a cool new research, and share with each other. So, and we try to get students, to get to know each other, to form some bonds. But those are our attempts, thinking we're trying to foster a collaborative community, because everything works better in a collaborative community. But Marty, you want to speak to how that worked for your group, or
Yeah, absolutely. Yeah, especially when you started moving into the R code, because I'd had background in R code, I was there were a couple of us that were able to kind of like put together little snippets that might make a map look better. Yeah, really. And earlier in the coursework as well, just putting together or posting just maps that you like, just kind of getting an idea of what aesthetically makes sense for putting a map together. Because, that's what it kind of boils down to. Maps are really useful communication techniques for the general public. People look at maps and they see where they are in the map and kind of understand where they are in the data. And it's something that really engages people. So yeah, just putting together a map that looks good, that looks professional. It's an ongoing thing that people work on. So it was really nice to just kind of uh, always have that Course Plus atmosphere where we could go and ask simple questions, complicated questions, really thought-provoking things. Yeah, because we dabble in things like ethics. That's always part of the coursework when you're talking about public health. So yeah, a lot of thought-provoking things that people post that yeah, kind of expanded the way that I thought about the work. So yeah, it was nice.
I know, well, from our perspective, at the end of the 2 years when it's graduation time, everyone's invited to come and walk in the ceremony, but we have a little reception the night before, and it just seems like everybody knows each other. Like, nobody's physically
Yeah.
met, but all of a sudden everybody's like, "Oh, there you are," So
Yep.
it's a very upbeat, friendly feel to the scene here.
Yeah. I still keep in contact with the numerous people that I graduated with. Yeah, and we keep tabs on each other's careers, seeing how we're kind of developing. Taking what we learned and applying it to different things. Yeah, it's been great, and it was just fantastic. Just a little week in Baltimore, and we even planned activities actually that were outside of the official Opal gatherings. We went to Fort McHenry and walked around, uh, and so yeah, it's great to some people actually. So I had actually met a couple of people that were also in Seattle. We kind of did a little bit of in-person studying during one of the classes. So, you might have that opportunity as well. Some people you won't meet until you go walk in the ceremony, but yeah, it's definitely rewarding either way.
Frank, you're on mute.
My apologies. Just to follow up a little bit on that, because we've been asked this in the past. So, even though this is, one of Hopkins' part-time programs, online programs, you're treated like no different than any other student that might be here on site. So, not only are you invited to graduation and you graduate with all the other students that are graduating from the different departments, PhD, masters, and so forth. And we had that little reception just for you guys the night before. but even throughout your academic years, I mean, you're invited to all the seminars and everything else that is going on at the school. Now, obviously, nobody is right around Baltimore, although we have had people in the past that were actually from the Baltimore area. But because of COVID now, a lot of seminars and so forth still remain on have an online option. So there are Zoom links being sent around for everything. So you're treated no different than any other full-time student that's actually on campus, which is really nice.
Mhm. Yeah, I actually did several of those yeah, miniature talks that happened with faculty outside of the coursework, and yeah, I found it pretty great.
And on top of that, you know, we have 8 departments and I don't know how many faculty in each, but um, students are free to contact other faculty, you know, say in environmental health, say, oh, I see you're a specialist in this kind of pollution or water, you know, sources or supplies, and try to build some relationships outside of just the, you know, course faculty too. So there's that access like any student would have, you know, to figuratively knock on the door and start a conversation with other faculty.
Do we want to open it back up to our attendees to see if we have any questions from our attendees?
Well, following up on that, Tim's point really quickly, I was wondering if any students sort of engage with any professors in the School of Public Health for research opportunities with them, or if because it's sort of a part-time program and people tend to be working professionals, if there's not really time or opportunities for that collaboration.
They likely not because of what you said, because most of them are working professionals. But you know, the Opal is a part-time online program. Hopkins also has an MPH, Masters of Public Health, that is part-time and online. And I advise some of those students, and they routinely ask me about research opportunities, and I tell them it's an open game. Just feel free to reach out to any professor, either you had as an instructor or you saw some of their seminars, or you just look at their profile online. You know, all that is available to you. You know, it's not something that I can help guide you or get you a research position. We leave it up to the students to reach out. We are certainly here as a reference for you and so forth. But yeah, you are definitely free to reach out and inquire about research opportunities.
I know it's been
Great,
successful
thanks.
for some students in the past too. Think about people working with the Center for Indigenous Health, and you know, I get them involved with the project with them, and next thing you know, they're running with that, and I think they got hired by them when they graduated. But like, you know, those things happen, but it's a case by case kind of thing.
Other questions or comments?
Hello,
Yep,
can you hear me?
we can, Ken.
Hi, hello. Yeah, thanks for the sharing session. So actually, I was intended to apply for the DRPH program. So, but I'm just trying to figure out what different type of programs are being offered in the school. Basically, get to know more about like what are the options that I may have. So I wonder, like, in case if I do the DRPH program, because I'm actually working in the health sector overseas. Are there any courses that is related to spatial analysis that would be part of the like electives in the DRPH, like with your program, like or any other or maybe any of your faculty that teach in the DRPH program?
So the DRPH program, the MPH program, individual departmental masters and or PhD programs usually don't have their own set of courses. All courses throughout the school are available to all students. Pre-COVID, it used to be, you know, very few of those courses were online or had remote accessibility. Obviously, because of COVID, that has changed. Tim and I teach a set of 4 core courses on site in spatial analysis. Tim teaches 2 in GIS. I follow up with 2 in spatial statistics. We've been teaching those 4 courses for a while here, and we actually took those courses and used that to design this online OPAL program in spatial analysis. They are pretty much the exact same courses, and now because of COVID, they also remain available in a remote access. So if you are in a DRPH program, you can take any of the same 4 core courses that Tim and I teach in the OPAL program. They're given a different course number. The name may be slightly different, but they are the exact same material, and they're taught by Tim and I.
Thank you. Thank you.
Sure.
I'd say that maybe the slight difference is for the OPAL programs, because everyone is kind of like working or typically working in their own study. So we kind of try to leverage that even. So that it's a little wider breadth of public health experiences or work experiences being shared. So that I don't call it the collaborative, but the networking aspect of this, I'd say, is stronger in the OPAL programs compared to the in-house programs where, you know, students come to campus and they're like, you know, focused on this one program in you know, 14 credits a term or whatever it is, and they're juggling a lot. And then in the spatial world, they're taking usually a 4-credit core course with a 2-credit course and sharing a lot with all of their classmates. So that's kind of maybe the main difference between the 2 options there.
Mm-hmm. Good point, Tim. Other questions or comments from our attendees?
Maybe we can ask Marty kind of like more of a general, you know, any advice for these folks who are considering the program, anything maybe we haven't covered or other thoughts you might have to add
Well,
in
the
there.
floor is yours, Marty. Bring us home with what was the best advice to these students and those that might be listening in later on.
Yeah, it really helps to get to know your classmates early on, and it's definitely a shared experience. So you'll certainly have that in common. But you know, saying that, the cohort that I went through the program with was very diverse in terms of their backgrounds, and it was pretty great to just learn people coming to the work from all walks of life. And they came from both directions, which was kind of interesting. Some came from a geography background and were looking to learn more about public health. Some people came from public health and wanted a solid set of skills that they could bring to bear. But yeah, it's great in the middle. You meet, you get to know each other, and it really pays dividends in the end, just to be able to help each other out, to draw on others' expertise. So yeah, get to know the people that you're in school with, because yeah, they'll be great, and yeah, and you'll be able to help each other out.
That's great advice, Marty, and a big thank you for joining our session here, as one of our alumni to confer some advice and information on to our attendees. Morgan, I think if you have any parting comments you want to share with the attendees or those listening from the recording.
Yeah, so thank you all for attending this session today. Thank you for people in the future who may watch the recording. We are currently accepting applications for the program. Although the deadline is July 1st, I always say get your application in sooner rather than later, more or less, because it always takes a smidgen longer than you would expect to get everything together for your application. If you are interested in submitting your application, we are offering application fee waivers, so definitely feel free to reach out to our team for that. But again, thank you everyone for attending. Thank you to our program directors as well as Marty.
Yes, and if anybody has any follow-up questions, you can find the contact for Tim and I easy enough online. Reach out to Morgan, the OPAL office. If there's a question that only Tim and I can can answer or answer better, the email usually finds us, and we're pretty responsive with that. So thank you again for everybody joining, and enjoy the rest of your week.